Welcome to the OMMedicine's module on eosinophilic esophagitis. So eosinophilic esophagitis is exactly what it sounds like. It is inflammation of the esophagus due to some sort of food antigen that then causes a large amount of eosinophils to react and therefore causes inflammation. And just as we see with many other eosinophil-dominated conditions, eosinophilic esophagitis is going to be associated with many other atopic disease processes such as asthma, eczema, allergic rhinitis, and really any other condition that has a predominant response of eosinophils. The presentation of eosinophilic esophagitis is going to be similar to that of any other type of esophagitis, so these patients will present with dysphagia or trouble swallowing or difficulty and pain with swallowing. They can have heartburn and food regurgitation after eating, and they may even have food impaction. Now, the presentation of eosinophilic esophagitis is relatively nonspecific, and as we just said, it will present similarly to any other form of esophagitis as well. So the diagnosis is largely going to be via endoscopy, which will show the characteristic findings that we would expect to see, and these are going to be things like linear furrows, stacked esophageal rings, commonly described as feline esophagus, and you can also see white streaks or white specks that would be representative of eosinophilic microabscesses that form. Now, the esophageal biopsy, also usually done during an endoscopy, is going to be the major way to confirm the diagnosis, and if the biopsy shows greater than 15 eosinophils per high power field, then that would be diagnostic of eosinophilic esophagitis. Now, it's also recommended that you rule out any other associated conditions that may be related to this, such as infectious esophagitis or achalasia, and this again is usually going to be seen on endoscopy if they were present. And one clinical pearl is that eosinophilic esophagitis may present very similarly to GERD. However, it will only have a minimal or no response to proton pump inhibitor or other acid suppressing therapies, whereas you would expect to see a large improvement in symptoms in the clinical picture if someone were to have GERD and they were treated with antacid therapy. And finally, let's talk about the treatment of eosinophilic esophagitis. And the first line and really the mainstay of treatment is going to be avoiding the trigger or the food that has caused this inflammatory reaction. So an elimination diet and avoidance of the trigger is going to be first line treatment. Now, if an elimination diet is not sufficient in managing the patient's symptoms, you can use topical steroids such as a fluticasone spray or oral budesonide, and there is also a monoclonal antibody that works as an IL-4 antagonist that is also approved. However, this is a relatively new drug and is really not used a whole lot at this time. And that brings us to the end of this module on eosinophilic esophagitis.